Hello, big team. This is Vincent Obita, and today we are going to cover a care plan of a patient who has had an operation and is experiencing pain. This is a request that was made by one of you in the comment section for us to cover prior to their examination. Now, for post-operative patient, it still will have the four aspects of care plan that you need to cover with the new test of competency format that has been recently reviewed. That is the nursing problem, the aim of care, the reevaluation date, and the care provided by nurses. Now, for pain, I'll use Daisy as an example in this case. And under the nursing problem, I'll just state that Daisy is experiencing pain due to surgical procedure following hernia repair, as evidenced by a pain score of 2 in a scale of 0 to 3. Under aim of care, I'll just state that Daisy will verbalize pain relief and have a pain score of less than 2 in a scale of 0 to 3 following nursing intervention. So under the measurable aspect is Daisy will verbalize the pain, and again the pain score. Well, I'll be putting less than 2. I'll just use the score that I provided in the nursing problem so that you don't confuse yourself or wonder whether the pain should go to 1, pain should go to 0. I'll just aim of anything below what the patient is experiencing. Then under evaluation date, for post-op, it is a bit different as compared to other care plans. So for pain in this case, I'll just state that to be reevaluated today. Remember, the document is dated, so even if I don't mention the date, if I state today, I'm still covered. So I'll just state Daisy, to be evaluated today, every 15 minutes for the first 1 hour, every 30 minutes for the next 1 hour, and 1 hour, hourly for the next 4 hours, or more frequently if the condition changes. It almost picks the aspect of monitoring of the patient following a surgical procedure. Just maintain that, because if you don't write that one, your prospects of getting this element of care plan is reduced. With that one, I'm now covered with the first 3 sections of this care plan of post-op. The next bit will be the care provided by nurses. You will just use the hemataric mnemonic and just modify it just a little bit. For example, now in this case for E, I'll just state explain and discuss disease care and gain consent. That will do for the E. For the M, I'll do monitor and record disease vital signs every 15 minutes for the first 1 hour, every 30 minutes for the next 1 hour, and hourly for the next 4 hours as per postoperative observation protocol or policy. That will cover, and remember, it's almost similar with what you had under reevaluation date. So you need to write very quickly, because these 2 statements are very long and they might consume a lot of your time during your care planning. Then your third point under A, you will state that administer prescribed medication and assess their effectiveness. You need not to bother whether they're analgesics or whatever. Just say prescribed medication. Your fourth point can take the aspect of assessing disease pain in terms of location and characteristic, noting both non-verbal and verbal signs of pain. and that will be your first specific point for pain. The second specific point would be teaching Daisy on deep breathing exercises and repositioning techniques to reduce her pain. Your third specific point will be refer Daisy to the pain management team for further evaluation and care. Those are three specific points just for pain. Then you get back to the general points, of which on additionally you will have instruct Daisy on proper use of call bell and place it within reach. And also there's the aspect of documenting all cares as planned. With all that, you would have captured all the elements that relate to pain. Just remember what you need to know. One, under pain element of care plan, just ensure you capture the numbers in terms of quantifying the pain score. Then again, give the scale, because there are some people who use scale of 0 to 10, and there's also those who use 0 to 3. So if you've chosen a different one, ensure you place that scale there, or else somebody will not know. Because if somebody is experiencing a pain score of 3, it is a different one if you are using a scale of 0 to 3 and a scale of 0 to 10. So you need to specify. Then while using the signs of less than, more than, be very careful so that you don't miss and compromise your statement in terms of the patient will report a pain score of less than this or more than this. You need to be very careful about that. Then the reevaluation date and the monitoring aspects are two long sentences. For the postoperative patient, you have to put those elements of every 15 minutes, every 30 minutes, and every hourly, irrespective of the care element we are talking about. Thank you very much. Check out the next video that will entail the risk of infection for the same patient. Thank you and take care. Bye.